What makes the live patient Dubai training facility stand out?
So the thing that makes the live surgeries facility stand out for me was, first of all, we're in Dubai. We've got 5-star accommodation that the delegates are staying in. It's a vibrant city, there's a lot going on, so people can make a holiday out of it as well. And the facility itself is really modern. They've got all the modern equipment, full digital workflow, CBCT scanner, so we can make sure that all the delegates are able to do the surgery in the best possible conditions. We've teamed up with Live Patient Dubai here in Dubai Healthcare City. We've got 8 delegates coming. They're going to treat 16 patients and a total of 24 arches over the 4 days. So how the live surgery program works is we've got 4 spacious modern facilities where the delegates can work on the patients. All the patients will be pre-scanned with the CBCT scanner, and then the delegates will get to see the full digital workflow using photogrammetry, intraoral scanning, through to printing the 3D provisionals using OnX Tough on the Sprintray printers. So the delegates are staying across at the Sofitel Obelisk, which is our 5-star hotel. There's a great gym on site, pool, multiple restaurants, so they can relax and unwind before and after the live surgery. The Sofitel Obelisk is just a 10-minute walk from Live Patient Dubai, where we're doing the full arching live surgery program.
How are the patients prepared and screened for the live surgeries?
So the patients for the live surgery program are made up of local residents and workers who wouldn't typically be able to afford this sort of treatment, wasn't it for the full arching program. Those patients have been pre-screened, they've had full CBCT scan, intraoral scans and photos, so that we can assess each patient to see their suitability for each delegate depending on the delegate's experience level.
What hands-on experience will delegates gain during the training?
So during the live surgery program, we're going to cover over the 4 days all the concepts relating to full arch. So we're going to go from basic all-on-4 techniques to the more advanced procedures that we use to treat more atrophic cases, such as pterygoid implants, palatal approach, trans-sinus and trans-nasal.
How many patients will each delegate treat?
Normally each delegate will get to 2 to 3 arches depending on their level of experience and also the complexity of the case. What we think is important is that the arches are completed to a high standard and not necessarily the number of arches that are done. So our goal is to train the delegates so that they're doing a really high standard of work. We get asked a lot, how many arches will I get to do on the program? That depends on the delegate, depends on the complexity of the case, but the goal is that we treat these patients with the utmost care.
What is the digital workflow demonstrated in the course?
We're going to trial some different techniques so the delegates can get a good view of what's out there. We're going to use photogrammetry, we're going to use intraoral scanning. We may use some palatal fiduciary markers to see how we can merge pre- and post-op scans. We may do some mid-surgery scans, also see how that technique is used. And then we'll be using the lab to design the provisionals using exocad, and we'll be able to nest those designs on the Sprintray printer. And then the delegates will get to see how those provisionals are processed, cured, and finished before we fit them onto the patients towards the end of the weekend.
What materials and processes are used for designing and printing restorations?
During the full arching live surgery program, we're going to be using a fully digital workflow. We'll show the delegates some different techniques that we use. We'll use photogrammetry, we'll use intraoral scanning. We may use some fiduciary markers so that the delegates can see how we merge pre-op and post-op scans. We'll also trial some mid-surgery scans so the delegates can see how that technique is used. And then they'll get to see the design process, which is done by our lab using exocad. We'll get to nest the design of the provisionals onto the Sprintray printer. We'll then get to see how the OnX Tough material works, how it's finished, how it's processed, and then the delegates will get to fit the final provisionals in the patients towards the end of the weekend.
Who is this training suitable for, and how can it benefit dental practice?
Our live surgery program is aimed at those clinicians who've got some experience with full arch implant treatment but want to refine and finesse their skills.
What led you to develop the full arch program?
The full arching education program was born out of an obsession with all-on-4, with full arch implant techniques. So I've been doing this procedure for around 10 years. I've done many courses across the globe, and one thing that stood out was the fact that I left many of those courses missing some certain bits. So we put the full arching program together to cover everything, not just the basics, but the advanced techniques. Not just the good stuff, but the bad stuff. So we cover the failures, we cover the complications and how we manage those. We feel that we've now got a really comprehensive training program that covers everything from A to B, and that can benefit those with very little experience who are trying to expand their skills into full arch, but also benefit those experienced clinicians who want to refine their techniques.
Why did you choose Dubai for the live surgery program?
First of all, Dubai is obviously much more accessible, to different countries. It's kind of a central hub now. So certainly for those Australian delegates, getting to Dubai is much more simple to say going to live surgery programs in South America. It's also a very safe environment to stay. It has 5-star luxury accommodation, great food, great entertainment. And yeah, we just feel like it's a great location to run a live surgery program.
What does the structure of the course look like?
So the way we've structured the live surgery program is we actually do some pre-course training with the delegates. So we do 2 Zoom lectures where we can run through how we plan out cases, which may be a little bit different to some other full arch clinics. We then meet in Dubai. So we arrive at the hotel. The delegates can arrive a few days before if they want to acclimatize. And then we kick off the live surgery program with a tour of the facility. We then do a day of lectures where we go through all the surgical protocols in great detail. And then the next 3 days is all about the surgery. So we're going to be operating intensely for 3 days, 2 delegates per patient, and they're going to complete a number of arches together and then complete the treatment towards the end of the weekend by fitting the provisional restorations on each patient.